Could you say your first and last name for us?
Thurraya Kent.
All right, and you live here in Fairfax County.
I do. I live in Annandale, Virginia.
Well, tell us about yourself and tell us about Malcolm.
Okay, well, I live in Annandale, Virginia with my husband Al and my son Matthias. And until January 28th, 2023, we were here with our son Malcolm. Malcolm died of an overdose. Discovered it was a fentanyl overdose. And he was the kind of a glue, you know, when a family is together, each family member plays a part, and when one part is no longer here, it's really hard to fill that hole.
How big is that hole for you right now that Malcolm's gone?
Wow. Well, so we are sandwiched between bereaved Mother's Day, which some people don't know exists, and Mother's Day, and Fentanyl Awareness Day. So it's all coming to a crash. When I think of like, how do you describe Malcolm? People always say best hugs ever. If you were lucky to get a hug from Malcolm, you knew you had been hugged. Kind of quirky in his personality, enjoyed having fun, but could be very serious. He was on the autism spectrum, so sometimes the way he would see things and respond to things was not neurotypical. And so a lot of times that actually, we look at it as a blessing, because you think, wow, I never saw it that way. I never saw life that way. So life right now is just trying to rebuild, really trying to rebuild, and trying to make sure that we hold on to the memories that he taught us by just being him.
Looking at the scrapbook you showed me, he was loved by his parents, loved by his community. Mm-hmm. Tell me about that. Well,
he was an active member of Capital Baptist Church, their teen program. He loved volunteering with younger kids, especially kids who perhaps didn't do things the way adults we always expect them to do. So the ones that got into trouble a little bit more, Malcolm spent more time with. The ones that had a lot of energy, where you would want them to run around the building before they come to their Sunday school lesson or something, he spent time with. And he just, if he was a friend, he was a loyal friend and cared a lot about you. And he would definitely let you know that.
What happened?
Wow. In some ways, we'll never know what happened. I do know that Malcolm had always had some challenges, being on the autism spectrum, having some behavioral health issues, and that just, I think it just got too much, and he started trying to self-medicate. He got in trouble at school, rightfully so. He did something that was wrong. He admitted he did it was wrong, but unfortunately the way our Student Rights and Responsibilities program in Title IX works, it was enough to have him relocated to another school. So that meant a child who did not handle change well had to start all over again halfway through high school. And then that's when we noticed something was just a little different. And that's when we found out that we had an incident at the house. Took him to medical, and they're like, yeah, he taken a pill or something. Like, oh my goodness, what's going on? Started going through the long process of therapy, treatment. Learned a lot of things about these resources we say are available, but when you really need them, they can be very hard to come by. And he was doing well. Senior year, figured out what he wanted to do after high school. Said, college was not for him, but he wanted to work with his hands. Been doing origami and building and creating things. And then we got, I don't think it's by accident that the week he broke sobriety was when the week we got a letter from the school board saying that he was eligible to go back to his home school. He had met all of their requirements. So this would have been senior year, the end of the first semester senior year, trying to wrestle with the decision of, do you stay where you are, or do you try to get back with your friends? Do you try to get your eligibility back to play sports, lacrosse, which he loved and everything? And one night, I smelled something in the house, and that's burnt popcorn smell that some people talk about. And it's like, what's going on? And he was just so disappointed with himself. He ripped off his sobriety bracelets, started screaming at himself. My husband took him to the ER. Of course, the ER visit is a long visit. During the visit, he and my husband had some good conversations about, okay, how do we start over? You can start over. Came home from the ER that morning, and by the following morning, he was dead.
You think he took a pill?
We're not sure. Like, I know when he fell asleep, after coming back from the ER, he was, something just didn't seem right, because he was snoring, which of course, now that after all the resources come available after your child dies, we discovered that could have been a sign of an overdose. Well, I did call the ER to ask, did they give him anything or whatnot? And the person on the phone told me to let him rest, that he just needed his rest. So I have to live with the fact that instead of calling 911, I called the ER, because letting him rest meant eternal rest.
What do you want parents to know about Malcolm's situation, and what could they learn from this?
Wow. So if I look at what I would want my family to have done differently, would treat it more like a medical situation than a disciplinary situation. Everything that we encountered with the school system, and I'm an active school volunteer, but it was all about discipline. And it was, how do we keep him in school? How do we keep him in school? Well, frankly, it would have been better to pull him out of school, find out from doctors. What we now know is how quickly a young brain that is still developing changes after initial drug use. I mean, it doesn't take much at all, but that's not something that we were being taught. That's not something that was being talked about. It was being, people need to, if they just do what they're supposed to do, if the kids just say no, there's more to it than that. So I would encourage parents to really learn the medical parts of it, and think back to when they were 14, 15, 16 years old, how big some of the things that were going on seemed. How, if your friend didn't talk to you that day, how did that make you feel? Some of the stupid stuff that I'm sure we all did as kids, well, nowadays, those stupid things can kill us. And as a community, we haven't embraced each other enough to say, okay, let's stop, blaming the kids. Yes, they have some fault in it also, but what are we putting in front of them that encourages this type of behavior?
We have some questions you sent us yes. for public officials to
Mm-hmm.
answer. We'll start with this. Medical professional and local school boards and superintendents, you're asking, how does opioid use impact the young brain even after first use, and how is this medical knowledge reflected, and how schools deal with students who return from treatment into the classroom? Why is that question important to you?
Well, it's important because after Malcolm died, I attended one of the open houses that Fairfax County had, Fairfax County Public Schools, and I'm glad they had an opioid discussion. But to hear this physician talk about the impact on the brain, and then discover that none of that was taken into account when my child was going through this process. When we went through, so according to the student rights and responsibilities, when a child has opioid use or certain drug use at a school, and we suspect something happened at school, because when I went to pick Malcolm up I was at the school and they said, something's not right. I want to take him to the doctor. Well, I removed him from that school situation, took him to medical. All of that information was read back to us at our hearings process. So my child comes in, he admits everything he did, but all of the evidence is an email from mom saying, okay, here is what we think is going on. Here is what our plan is. And in my mind, I'm trying to partner with the schools. That's not what happened. What happened is everything that mattered to a 16-year-old at the time, and then the 17-year-old gets taken away. And so there's really not much for them to aspire to at that point.
And then you also have for local school boards, your question is, what is the role of county substance abuse prevention specialists, and given increased awareness of drug misuse by teens, why are many of them responsible for more than one high school? Why is that question important to you?
Well, it's important because we see these press releases saying that there's something going on in the schools, that there's an overdose. And oh, by the way, the press release doesn't mean that's the only thing that's happened. In our community, our children are hurting, okay? And I'm not talking about adult substance misuse, but our children are hurting, and we need to figure out how to help them. Having part-time help on something that is a matter of life and death seems kind of silly. I mean, it just, it doesn't make sense. We're saying this is important, but that's not what we're spending our time on. And really not. And I've been in enough PTA meetings to listen to us talk about, you know, who can go to this school and who can go to that school and that kind of thing. And I'm like, you know, that's not life and death. We need to really value the lives of each of these children and help them figure out that they can recover and move forward.
And on the Fairfax County Board of Supervisors, the Mason District Supervisor, you're asking, how are so many vape shops being able to get business and zoning permits and business loans in concentrated areas such as Annandale, Virginia, where you live? Have we traded profit and tax revenue for the negative social impact of having these shops so close to our children? Why are those two questions important to you?
Well, I believe we have traded profit and revenue for this. If we think about, yes, none of these products are legal for children, but we know that when you have these products in the community, some of it's going to get to our children. And it starts with vapes, which at one point we were telling was harmless and less harmful than smoking. And then chemicals start getting added to it, and it's not regulated. And then the next thing you know, I'm driving around Annandale and there's signs up for kratom, which is a hallucinogen, which is illegal in many other nations, which the FDA actually wanted to ban, but has decided they need to do more study. And yet we are advertising it everywhere in my small town. How is it easier for our kids to see that than to get actual mental health care?
And on kratom, you have a question for the Virginia Attorney General. And you have a few questions for them. One is, why is kratom unregulated despite its impacts on the brain and the body?
I mean, if people just look up what this is, basically it is a legal version of what some people may call PCP. It is a hallucinogen. It is unregulated. It is advertised everywhere. We would not advertise any other substance that could be that deadly in front of our kids. There are no offset zones around schools. There are no offset zones around churches or any places where we want people to convene. It's just, we've traded for profit. And we can't then say, oh, but our kids should have been strong enough, or Malcolm should have made these better decisions. Well, yes, he should have made some better decisions, but as a community, we should be helping our children make wise decisions. And one of the wise decisions is really thinking about what we want to invest in as we're driving down these roads.
Also, you're asking the Attorney General's office, why doesn't the law require hospitals to test for fentanyl? How can society address a problem we can't quantify? And then you quoted the Scientific American 2023. Tell me about those questions.
Okay, so they don't test for fentanyl. The only person that actually tested for my son for fentanyl was the medical examiner. that doesn't do me any good at that point.
After he passed away.
After he passed away. So when you go to a hospital with an ER, the aftercare instructions you get is you are suspected of having a drug overdose. And then it says, fluids and rest and that kind of thing. How can we solve an issue if we don't even know what the problem is? Because all we're doing is data after the fact. Now, doctors and others will say, well, the treatment would be the same. Our treatment may be the same, but I think our policies would be different if we actually knew how many kids are going through these ERs or even having to deal with withdrawals at home or something if we were able to test for these things.
And you have some questions for the Virginia governor, a few of them actually. Mm-hmm. One is, what is the Commonwealth doing to increase the number of youth treatment facilities, including inpatient care? How does the Commonwealth and insurance companies regulate private youth treatment facilities? And what is the measure of effectiveness?
So, it's hard when you find out that your child has a substance problem. The child recognizes it and says, Mom, I want to get help. And then all you do is get on waiting list after waiting list. And you call and you call and you write. And then someone will say, oh, well, we can't take someone who is on the autism spectrum. We're not treated for that. Oh, we have a female bed or not a male bed. Oh, well, the closest bed that will take your insurance is in Texas or in Florida or something like that. And your child is looking at you and saying, Mom, I don't want to go to Texas, but I want to get better. I don't want to have to go so far away from home, but I want to get better. So why isn't that care available in Virginia? Why have we limited so many youth beds? Our capacity to treat youth in our own state is not keeping up with the demand, unfortunately.
And on here, you have some questions from medical professionals, such as, what information do hospitals provide to families after a child is treated in the ER for a suspected overdose? What is the aftercare? How quickly is the child seen again? Try to get an appointment after a late hospital visit, and when you called the ER after your child was seen because of his sleep seemed odd. Tell us about that.
He was snoring. And at first, you're like, oh, okay, he's finally able to put some of these thoughts behind him, because he was so hard on himself. After breaking sobriety, Malcolm was very proud of the fact that once he made the decision, I'm going to treatment. And so he would wear sobriety bracelets. And so anyone who was around him knew that he was going through treatment. I actually, as a parent, I was like, oh, well, maybe, take it off before you go to church, or take it off before you go to, with these people or that people. But he's like, no, I need to admit what I've done. And that night he was so hard on himself, and he cleaned his room and everything, but he had ripped off the bracelets, and I got to start over, that kind of thing. And so when he finally fell asleep, I was actually comforted, because I thought, okay, he's going to be able to be peaceful tonight and calm down. And he actually had to go to work the next morning. So we're like, okay, and he needs rest, go to work the next morning. But then he doesn't snore. And so that was odd. And so when we talked to when I called the ER, I was like, did you give him something that helped him sleep? Because sometimes they talk about, oh, they need rest, and it actually says in your aftercare instructions that they need rest. And the person told me to let him sleep. And worst decision ever. So call 911. When in doubt, call 911. We also found out on the autopsy that some of his prescription medicine, when we had a meeting, he was on a medication to help him sleep. And afterwards, a meeting with the emergency room team said that Yeah, they should have told him not to take the medicine that day. So, again, as a community, we can do better. We can do better. I wonder if if we're so overwhelmed by the problem that we're not treating each and every situation as a person with a life and value, and then the family and the community that surrounds them, or if we're just trying to get people in the emergency room and out. Because I would think after the situation that probably for a minor, they probably should stay in the hospital for 24 hours and actually have a follow-up appointment. In your follow-up care, they say make a follow-up appointment, but no one says how long it takes to get a follow-up appointment. It does not take you to the front of the line when your child has a suspected overdose. You still call the doctor just like you normally would. You tell them what's going on, and they see if they can fit you in. And normally they're fitting you in so you can get a referral to go to someplace else. So the system, we've got to do better.
So for Malcolm's legacy, you have a few proposals, some things you want changed. Mm-hmm. You want a law requiring emergency rooms to test for fentanyl so that we can have the data on the true extent of the problem. You say testing doesn't affect the initial treatment, but it should provide necessary information for effective aftercare.
Yes.
Also here, standardized procedure that keeps a minor child in the ER after a suspected overdose until a follow-up appointment for treatment is secured, and procedure in local schools that help children with identified substance misuse issues succeed in treatment and in school.
Yes. I think all of those things would be a start. I mean, starting with the school is so important. If a child is going to school is so important because that's their world. And so it was one thing to tell Malcolm, hey, it's your senior year, things will get better. We just got to get through this. We got to get through this. But that's their world. They don't have the knowledge of 30, 40 years of experience to say, oh, this is just one part of my life that is hard and I need to fight harder. That's not it. So we need to help them in their world with school. Give them a path to get back into school. Give them a path to be around their friends, to still be able to participate in all the things that makes learning actually fun and also informative for them, because that's them growing, that's them maturing. So that part, I believe, is very important. Testing, I don't understand how we are trying to solve a problem without identifying what the problem is. I'm retired military. You don't just figure out we're going to do something. Before you say you're going to do something, you have to identify what the problem is, and you have to have data and use that to say, okay, let's make a data-informed decision on what our best courses of action are. And we're not doing that. We're just throwing things at the wall and then wondering why it's not sticking.
When was he born?
July 30th, 2005. Malcolm was adopted. So he was adopted out of Omaha, Nebraska, with a wonderful birth family. That also did cause some struggles because he always wanted to, that torn of feeling in. He knew he was adopted. But he was just bouncy and energetic, always energetic. And then I think it was probably around age 4 or 5 when we started noticing a little developmental concerns. But even with that, as long as he was in his element, so being outside, camping, digging the mud, hiking, all of that, it was good. Swimming.
And what date did he pass away?
January 28th, 2023.
What do you want his legacy to be? Oh, before I ask that question,
Yes.
do we know how he got the potential pill that may have been laced
No.
with fentanyl? Not at all.
No. So Fairfax County Police did some investigations. They went to the school. They went through his phone. The comforting thing is what they found in his phone showed that he actually was not drug seeking. So that was the mom comfort. And there was even something in his phone saying, well, I don't do that anymore. And him talking to someone about the importance of staying sober. What we have not been able to get a hold of is, we know he had a Snapchat account. We would like to see if there's anything in there that could help, because that person knowingly supplied a pill to someone they knew was in treatment. So there's a problem there. It should be resolved, but Snapchat says it's a privacy issue. So if they get if the police get a warrant, they will release Malcolm's files. Police can't get a warrant without knowing what's in Malcolm's files. So basically, Snapchat has us in a catch-22. And the last email I got from them is, well, if they see anything in Malcolm's record that they think is concerning, they'll let us know. So now I have to rely on them to make a decision on whether or not I, as his mom, have the right to know what was in his account, even though he's a minor.
So the supplier's still out there?
Yes. Yes. Mm-hmm. And I know our police, they work overtime trying to get this poison off the streets. And it is poison. It is poison. And that's why we as a community need to work on it. We can't leave it to the schools or the police or whatnot. We have to come up with a comprehensive way that every aspect of the community can start working this out.
What do you want Malcolm's legacy to be?
I want for our family and his friends to always remember his laugh, his hugs, and how really talented he was. How there was nothing halfway with Malcolm. You know, it was intense. Everything was, whatever he did, whether it was good or bad, unfortunately, he did it to the extreme. And so I want people to remember that. I don't want them to forget the impact that he had on them. And then I want something to change. I want to be able to drive through Annandale without a vape shop every 500 feet. I think I would encourage people to just drive around their neighborhoods and start counting how many places are selling Delta 8, kratom, all of this poison. And keep in mind, yes, it's legal for some people, but anytime we put that much into our community, it's going to seep into our children. One of the ways we stop getting it to seep into our children is to have less of it in the community.